Gluteus medius, and actually for the minimus, the piriformis, the go-go's, whatever external rotators we have, if you look at the patient as they lay down, her feet are externally rotated on either side, at least the whole lower extremity is rolled out. That's our first indication that we want to put a hand above the thigh, one below the leg, and see if we can roll her in. Now, ideally, the inside of her foot should be touching the table. And we can do this across the body. Again, it's not going either direction here, so we're thinking medius, possibly minimus, and we'll be looking at both of these. Let's go ahead and turn over on the belly again. Okay, in treating the medius, we can come all across the crest of the ilium. And as we do that, if we drop right below, it's kind of fan-shaped, so we can locate spots all the way around. One of the interesting things is close to the sacrum area, this tends to create SI joint pain. Out towards the lateral aspect, the farther out we get, the more likely we are to get muscles that tend to create more of the sacral pain. And rather than doing a lot of mobilization and stuff on the sacrum, if we come out and actually treat along these particular fibers, we should be able to have more of an effect. So this would be our medius. Now to get to the minimus, what we're going to do, put our fingers in the same position, slide down until we feel a thickening in the tissue. And that's where we're going to look at to find some gluteus minimus fibers. The more anterior fibers tend to pain more along the outside of the thigh and the outside of the leg, whereas the ones that are more posterior, they tend to go down to the back of the leg, maybe a little bit in the top of the leg. Again, we have something really good right here going on in the minimus, and hopefully this will make a good change for her. Let's turn over on the back. Down and see if we're able to roll. And again, we're going a lot farther towards the midline than we did before on that muscle. So that was the medius and the minimus.